Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? As our country faces a federal government shutdown, some sources are saying healthcare won't be affected. However, depending on the length of the shutdown, funding and programs could be put on a dangerous hold, compromising the future of healthcare for many American communities. Specifically, home care and telemedicine will be affected because of the newly expired CMS Hospital at Home waiver, which also impacts in-home technology and medical equipment. Some programs will not be able to continue under these conditions. Leading up to the stopgap budget deadline, Trump threatened federal healthcare staffing to persuade Democrat lawmakers to cave to the GOP agenda around the ACA and Medicaid cuts, even though the lead-up to the showdown involved a noticeable lack of negotiation between all parties. The biggest issue motivating the conflict is the expiration of the Affordable Care Act's enhanced tax credits. KFF Health News recently published a calculator to help determine how much more people will pay in premiums as a result of the expiration. While a government shutdown will certainly affect our nation's healthcare system, we cannot back down from insisting on preserving healthcare resources for our patients and our communities. On to the damage report. Hospitals are required to have plans, policies, and simulations for virtually every potential disaster. But according to a recent report, at least 170 hospitals are at risk of serious flooding. One hospital in Tennessee would be submerged up to 11 feet of water if an intense storm flooded the nearby river. When flooding occurs in a healthcare facility, it impacts life-saving equipment and operations, as well as roads surrounding the facilities and access for both patients and staff. Hospitals at risk of flooding have emergency planning in progress, and they do it all the time in light of these recent reports. But the industry's primary concern is around the inconsistency between these recent reports. But as we see the Federal Emergency Management Agency and the ongoing changes to local climate changes, those impact as well. Many sources of FEMA data are locked behind paywalls, limiting access to what should be public safety information. Ultimately, the lack of integrated emergency preparation will have a direct impact on patient care and the health and safety of our communities. Another area of damage of rural health is dropping patient numbers resulting from federal cuts to healthcare funding. One instance of this is at the National Institute of Health Clinical Center, where the number of patients receiving care for rare or life-threatening diseases has started to decline. Behind these numbers, NIH cites the loss of Health and Human Services staffing and the cuts to scientific research. As long as the healthcare funding upheaval continues, the trend in volumes will likely continue across the industry. And now for today's success story. This week's success story comes from our very own Hillsdale Hospital in Hillsdale, Michigan. Last week, we launched our mobile rural health clinic to address the primary care needs in the more remote parts of our service area. As we've learned on this podcast, independent rural hospitals have to be creative to solve some of the most pressing challenges in their patient populations. Our patients face barriers like transportation, inflexible work schedules, and even internet access or the lack thereof. So a mobile health clinic will improve access to healthcare services for these neighborhoods. You can learn more about what we're doing with this project at hillsdale.com/mobile or on Hillsdale Hospital's social media channels. Thank you to our sources for this episode: KFF Health News, Becker's Hospital Review, Modern Healthcare, and Hillsdale Hospital.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.